Surgery and Pacemakers, what you need to know. Hey everyone, welcome back to the channel. Today, we're talking about a super important topic for anyone heading into surgery with a pacemaker. Whether you're a patient, a loved one, or even a healthcare professional, this episode will break down exactly what you need to watch out for, and how to make sure everything goes smoothly. So, let's get into it. Preoperative prep, getting to know your pacemaker. Alright, first things first. Before you even set foot in the operating room, you need to know your pacemaker inside and out. Grab that pacemaker ID card. It's got all the essentials: the brand, model, what settings you're running, and why you got it in the first place. Is the patient pacemaker dependent? That's a huge deal because, if so, even a small hiccup could be life-threatening. Don't forget to check the battery life. 2. If it's running low, you might need to have it replaced before any surgery. And listen, this is the time to bring in the cardiology or electrophysiology team. They can run a full device check, maybe even interrogate the pacemaker to see how it's been performing. Sometimes, they'll recommend reprogramming, especially if the patient is pacemaker dependent and the surgery could cause some interference. In the OR, electromagnetic interference, EMI, and how to handle it. So, what's the big danger in the operating room? It's electromagnetic interference, or EMI for short. Things like electrocautery tools, MRIs, nerve stimulators, even radiofrequency ablations, they all can mess with pacemakers. What kind of problems can EMI cause? Well, it could make the pacemaker stop pacing, which is bad news for someone who relies on it, trigger inappropriate pacing, or even reset the device to a backup mode. Yikes. Here's how the pros handle it. They use bipolar cautery if possible, since it's way safer than monopolar. But if monopolar is a must, they'll make sure the grounding pad is placed far from the pacemaker, like the thigh, if the surgery's in the upper body, and they keep those cautery bursts super short, less than 5 seconds at a time. And let's talk about magnets for a second. Sometimes, placing a magnet over the pacemaker can switch it to a safe mode of sorts, asynchronous pacing, but not all pacemakers respond the same way. Plus, this isn't a perfect substitute for formal device reprogramming, especially in high-risk cases. Monitoring and post-op, keeping a close eye during surgery. Continuous ECG monitoring is a must to catch any pacemaker misfires. If the patient's unstable, pulse oximetry and even an arterial line might be used. And for those who are pacemaker dependent, external pacing or defibrillation pads should be on standby. After the operation, if there was a lot of device interference, or if the patient is super dependent on their pacemaker, the device should be checked again by the cardio team. Watch out for any irregular heart rhythms or signs the pacer's not doing its job. And MRI? Only if the pacemaker is specifically rated for it. Otherwise, steer clear. Special cases, ICDs and MRIs. Now, what if the patient has an ICD? That's an implantable cardioverter defibrillator? Those can deliver shocks if they sense dangerous rhythms. For surgery, you have to disable those shock features temporarily so the patient doesn't get zapped by mistake from EMI, and then reactivate them after. And with MRIs or radiation therapy, extra precautions are a must. Most pacemakers aren't MRI friendly unless specifically designed for it, and radiation can actually damage the pacemaker's electronics. So shielding is key. Quick recap. The must-do list. Checkmark pre-op. Know your pacemaker. Check for dependency. Get the cardio team involved. Checkmark intra-op. Minimize EMI risk. Use bipolar cautery. Monitor ECG. Keep backup pacing on standby. Checkmark post-op. Have the device checked again if anything seemed off during surgery. So there you have it. With the right prep and teamwork, surgery with a pacemaker can be done safely. Thanks for tuning into the Everything Surgery podcast. If you found this helpful, don't forget to like, subscribe, and hit that notification bell for more health tips and medical deep dives.